Kenalog, the hay fever steroid injection. The drug name is actually triamcinolone, and it was typically offered on the NHS. It was given once a year. The effects would last between 3 to 12 months, and it was considered a pretty good treatment for hay fever. However, there were a lot of risks and side effects and complications that came off the back of having this injection. Now, many people will have been able to tolerate those risks and side effects and complications, but overall, it was deemed that it wasn't an effective treatment because of how many people were presenting with the complications and side effects. For example, repeated use can lead to a thinning of the bones, something called osteoporosis, which then puts you at a higher risk of having a fracture. And it's not that you'll take one injection and then you'll get osteoporosis. It's that steroids are known to reduce bone mineral density, which means that repeated use is likely to increase your risk of osteoporosis. Also, given that it's quite a decent dose of steroid, once that steroid is in your body, we have no way of taking it out. So if you then do start exhibiting symptoms of like headaches, high blood pressures, psychosis, depression, mood swings, there's not a great deal that we can do about it. And from the time that Kenalog was available, we've actually got newer, better treatments for hay fever. You have your medical treatments, which could include eye drops, nasal steroids, nasal antihistamines, and even oral antihistamine tablets. And we now even have a newer generation of antihistamine tablet, which is more effective than what was previously available, let's say 15, 20 years ago. And that can be bought over the counter, and that medication is called fexofenadine. There is also something called immunotherapy, which can help to manage the symptoms, which is deemed more effective than Kenalog, and it involves injecting small amounts of pollen under the skin so it sensitizes our body and helps to reduce the symptoms. And then there's all of the other lifestyle and non-medical treatments, like putting Vaseline around your eyes, nose, mouth, wearing wraparound sunglasses, not walking through freshly cut grass, not drying your laundry and clothes outside, changing your car filter regularly, things like that. There are loads of other options and things that you can do to help, but all of that together should hopefully help to manage your symptoms. Do me a favor and send this video to someone who has hay fever, and have a chat with a pharmacist or a doctor if you have any concerns.